mamas, it's Kelsey from Moms Melanated Milk, and today we're going to talk about overcoming common breastfeeding challenges. We're going to talk about a couple of different topics, including difficulty latching, engorgement, as well as managing a low milk supply. Latching issues can make breastfeeding very uncomfortable or painful. Breastfeeding should not be uncomfortable or painful. If it is uncomfortable or painful, it is a sign that your baby does not have a good latch. And at that point, it's important to see your breastfeeding peer counselor or your lactation consultant to get an assessment with your latch. Most common thing that I have been seeing recently when moms have difficulty latching is flat or inverted nipples. This just means that the mom's nipple isn't protruding outwards. It's actually more flat and flush with the areola, or is actually going inward. And it's a couple solutions. You can try pumping before each feeding, which will essentially just take the nipple and pull it out in order for your baby to establish a latch. Or you can also try a nipple shield. The nipple shield pretty much does the same thing. It gives the baby something to latch on, and then they suck the nipple out. So either or is a solution for flat or inverted nipples. Another issue that I see moms experience is not properly putting their boob in the baby's breast properly. So typically I will see moms who have difficulty latching or have pain while breastfeeding just putting the nipple into the baby's mouth, when actually you should be trying to get as much as the areola in the baby's mouth as possible. Some moms have a larger areola, so it's not possible to get the complete areola in the baby's mouth, but as much of the areola as possible. And when the baby latch, you want the baby lip to kind of be like a fish, flanged out like that. And you want to listen for swallowing cues and things like that, good signs of latching, which we can go deeper into in another video. So let's talk about engorgement. Engorgement is when your breast is full. I don't even want to say to capacity, but it feels like it's to capacity of milk. It causes your breasts to be hard to touch, swollen, they could be red, and also painful, causes a lot of pain. I like to talk about engorgement because it usually happens whether or not the mom decides to breastfeed. Mothers actually start producing milk 16 weeks gestation. So even if moms decide not to breastfeed, I still like to educate them on what engorgement is and how to prevent it, because I like preventative care, and then possibly treat it if you do have that. So how do we prevent engorgement? One, you want to empty your breast regularly, whether that be bringing your baby to breast and feeding baby from your chest, or whether that be pumping and expressing the milk, hand pumping using an electric pump, expressing the milk out. You want to make sure you're not going more than 4 hours without expressing milk. That means without baby latching or without you getting the milk out of your breast in some way, shape, or form. Typically, moms experience engorgement around day 3 to day 5. That's because you have that transition from colostrum to mature milk. And so you're going from making 5 to 7 milliliters to 2 to 3 ounces of feeding. And so that's when moms typically experience engorgement. So emptying your boobs regularly, emptying the milk from your breast regularly is a way to prevent engorgement. It's the only way to prevent engorgement, not letting that milk supply build up. So how do you treat engorgement? The first thing you want to do is empty your breast. So try to get on the pump, bring baby to your breast and latch them on, but try to express as much milk as possible. You can also go in with an alternating warm compress for 20 minutes, then cold compress for 20 minutes, and that will help with the swelling. A lot of moms, when they do experience engorgement, like to take hot showers. The steam from the shower does help pull the milk down and out. And if you would like to wear a milk collector so you don't waste that milk, you can get a haka or a ladybug or some form of milk collector to collect that milk while you're actually in the shower. So how do you manage a low milk supply? The perception of having a low milk supply is one of the main reasons moms begin to introduce formula or stop breastfeeding altogether. They think their baby is hungry, they think their baby is not getting enough milk, they're not producing enough milk for their baby, and a lot of times it just takes a little bit of education to reassure mom that she is producing enough milk. It is a very, very rare case that mom will not be producing enough milk for their child. I would like to just rest here and say that breastfeeding and your milk supply, it works on a supply and demand basis. So the more that you stimulate your breast, which means bringing your baby to your breast and latching your breast, or hand expressing or pumping the milk, the more milk you will produce. This is very crucial, especially in that first 3 days after giving birth, because that's when you are establishing your milk supply. That's when your baby is communicating with your body how much milk to produce. It's very important at this point, right after delivery, that you are either offering your baby your breast for 15 minutes every 2 hours or pumping for 15 minutes every 2 hours, just to establish a healthy milk supply for your baby. I would also like to let you guys know that your newborn stomach is only the size of a cherry, which means it gets full very quickly and it empties out very quickly. Because they're eating more frequently, mothers seem to interpret that as they're not getting enough milk. However, that is not an indication that they are not getting enough milk. An indication that they are not getting enough milk are if you are not getting the appropriate amount of wet diapers. And that can be explained as, if your baby is 1 day old, you need 1 wet diaper. 2 days old, 2 wet diapers. 3 days old, 3 wet diapers. 4 days old, 4 wet diapers. 5 days old, 5 wet diapers. 6 days old, 6 wet diapers. And 6 or more days old, you want to see at least 6 of those wet diapers. That is the indicator that your baby is getting the adequate amount of milk. Just because your baby is feeding frequently does not mean you are not producing enough milk. Babies go through their first growth spurt within that first 2 to 3 weeks after they are born. Babies lose 7 to 10% of their birth weight. And at that point, they are trying to get back to the weight they were when they were born. And because their stomachs are so small, they have to eat frequently to meet those very increased energy needs. If you are encountering any of these challenges, I highly recommend that you reach out to your breastfeeding peer counselor. If you do not have one, I will be more than honored to be your breastfeeding peer counselor and just walk you through your breastfeeding journey. I do have a comprehensive perinatal package that I will link in the description box below. And I wish you guys well on your breastfeeding journeys. And I will see you guys in my next videos. Peace out, mamas.